CBS 2 News in high definition.
Today's decision was a victory for people all over this country.
Obamacare was bad law yesterday. It's bad law today.
Right now it's 6. Constitutional, but to be continued. What's next for health care after the Supreme Court upholds the president's law?
Sleeping instead of checking for explosives, a security scandal growing tonight at Newark Airport.
On board the NYPD's new toy, a helicopter so powerful, so high-tech, it may even be able to stop a nuclear attack. Good evening, I'm Dana Tyler.
And welcome, everybody. I'm Maurice Dubois in for Chris tonight. And tonight, the president is declaring victory, and Republicans are vowing to repeal after today's surprise vindication of the health care overhaul.
The conservative Chief Justice joined court liberals in upholding the president's vision that you must buy insurance or be fined. The reasoning? That the so-called individual mandate is not a fine, it's actually a tax. But don't expect an end to the protests, both for and against.
We have team coverage, what it means for you and for the political landscape. Let's begin now with CBS 2's Dick Brennan breaking down the decision. Dick?
Well, Maurice, more than 8 in 10 Americans already have health insurance, but for the millions who don't, this is a crucial ruling, and it could mean serious changes in the health care system.
The highest court in the land has now spoken.
President Obama's signature initiative is upheld by the U.S. Supreme Court, and his supporters celebrated. The court ruled the individual mandate that says most Americans must obtain health insurance or pay a penalty is upheld. The end of lifetime limits on coverage stands. The rule allowing children to stay on parents' insurance till age 26 also stands, but the required expansion of Medicaid to cover more of the poor is struck down.
And I know a lot of coverage through this health care debate has focused on what it means politically. Well, it should be pretty clear by now that I didn't do this because it was good politics.
In a 5-4 vote, conservative Chief Justice John Roberts joined 4 liberals, while swing Justice Anthony Kennedy dissented with 3 conservatives.
That it wasn't split along the more obvious political ideological lines, I think that's good for the institution.
Roberts' majority opinion argued the mandate can be construed as a tax, and the government can lay and collect taxes. But in its dissent, the minority wrote, "In our view, the act before us is invalid in its entirety."
Obamacare raises taxes on the American people by approximately $500 billion.
The penalties for people who opt out rise quickly. In 2014, for families, it's $285 or 1% of your income, whichever is larger. In 2016, it jumps to $2,085 or 2.5% of income, approaching the cost of actually buying the insurance. Health experts say some 1.2 million New Yorkers will be affected by the plan, but a large majority will not.
Interestingly, it doesn't affect the people who have insurance now or on Medicare or Medicaid now. Life goes on quite the same for like 90% of the population.
As for the Medicaid provision it struck down, the court says Congress can't penalize states that opt out, but can still withhold money from those that don't meet certain conditions. Dana.
Thank you, Dick. The health care debate now turns to the states, where governors and legislatures have to develop a marketplace for the uninsured to find one-stop shopping for the best plan at the lowest cost. CBS 2 political reporter Marcia Kramer in our newsroom with more on the story. Marcia.
Well, Dana, there are tens of millions of uninsured Americans, more than 4 million in the tri-state area. And now that the Supreme Court says it's constitutional to require them to buy insurance, it's up to the states to develop a plan to help out. Our local governors have had varying degrees of success.
If you're one of the 30 million Americans who don't yet have health insurance, starting in 2014, this law will offer you an array of quality, affordable private health insurance plans to choose from.
Under Obamacare, each state is supposed to set up a so-called health care exchange, offering federal subsidies for the uninsured and a menu of plans to choose from. CBS 2 found that some states have worked harder than others. In New York, where there are nearly 2.9 million uninsured, Governor Cuomo issued an executive order establishing an exchange that will allow individuals and small businesses to tap into $2.6 billion in federal tax credits and subsidies. In New Jersey, where there are 1.3 million uninsured, Governor Christie vetoed a bill setting up the state health exchange. But Senator Robert Menendez says now Christie has to reverse himself.
But it would be ludicrous for states not to take advantage of the money that comes along with it to set up the exchanges.
Connecticut has about 377,000 uninsured. Connecticut has hired a staff and board of directors to begin implementing the exchanges.
Once states set up these health insurance marketplaces, known as exchanges, insurance companies will no longer be able to discriminate against any American with a pre-existing health condition. They won't be able to charge you more just because you're a woman. They won't be able to bill you into bankruptcy.
Still, the partisan divide on the health care issue is huge. Republicans say they will move to repeal it this summer.
It shifts from what we always had in this country, from a patient-based system to a bureaucracy-based system. That's a huge mistake. The last thing I want are 15 unelected, unaccountable bureaucrats telling me whether my grandmother can have a hip replacement or not.
Democrats want to avoid continued election year bickering.
Democrats remain willing to cooperate on potential improvements to the law. The time for quarreling is over.
The question now is how long the partisan sniping will continue and how fast the debate changes to jobs and the economy. Live in the newsroom, I'm Marcia Kramer, CBS 2 News.
So if the Republicans fail to repeal the law, here's what happens next. Starting next year, income taxes will go up for people making above $200,000 a year and couples making more than $250,000. Also, a new tax on medical device makers, and taxpayers will have to spend more on unreimbursed care before claiming deductions. Then, in 2014, the mandate goes into effect. Americans will have to get insurance or pay the fine. Most employers will face fines if they don't offer coverage for their workers. And an array of new coverage rules will take effect, including a rule that insurers cannot charge women more than men. Stay with CBS 2 and CBSNewYork.com as the implications continue to be revealed. And Scott Pelley will have further reporting and analysis next at 6:30 on the CBS Evening News live from Washington.
Also tonight, a heated